Hello, and thank you for your interest in participating in the SPOCC intervention study, which we're calling SPOCC5 for short. My name is Dr. Sam Merrill. I'm a GP working in the northwest of England. I'm an NIHR academic clinical lecturer at the University of Manchester, and I'm co-lead for Work Package 5 of the SPOCC program. So just to give you a bit of an overview of the SPOCC program, it's a large NIHR-funded body of work all focused on early cancer detection in primary care amongst patients with one or more long-term conditions. The SPOCC program is made up of 6 work packages, some of which are focused on looking at routinely collected data in relation to these patients. We've also done qualitative studies, recruiting patients and GPs, and we are now at the phase of developing and testing interventions to try and address some of the inequalities we've identified. Now, with the earlier research, we've identified that patients who have a history of anxiety or depression are less likely to be diagnosed through urgent suspected cancer referral pathways from primary care and more likely to be diagnosed after an emergency presentation, which can be associated with worse outcomes. On the basis of that, we have developed a simple tool for symptom communication and prioritization, which has had input from patients, clinicians, academics, and members of the public. And this part of the research aims to test the feasibility of this communication tool in a primary care setting. We want to look at how the tool is implemented, how wide its reach is amongst the patients of these practices, and the acceptability for both patients and clinicians. We will be recruiting practices in Devon and the West Midlands. We're trying to get a spread of practices across these regions to understand how this tool might work in different GP practices. We're aiming to recruit up to 8 practices overall, and we hope to involve about 400 patients in this study.
So my name is Rachel Winder, and I am one of the research fellows on the SPOCC intervention study, and I'm going to talk more about the SPOCC tool itself, what we considered when we designed it, and I'm going to say a little bit about how we hope the practice and your patients will be involved, and also how the clinicians can participate and what administrative considerations are required, and how we can support the processes involved in the setup and the running of the intervention. And lastly, we'll talk about what next steps for the practice would be. So just a little bit about the process behind the SPOCC form. Patients with a scheduled appointment within the next month are invited by the practice, usually via Accurix, using EMIS or System 1 or System 1's communication annex to complete the SPOCC form or the symptom communication tool. Have a look at the form if you've got one to hand, a paper copy, because this one's not always very clear on the screen. So what you can see is this tool is a brief one-sided form. It's designed to help patients communicate symptoms, potential of cancer, and to help prioritise which symptoms to address in a GP nurse consultation. We're targeting the tool at patients aged 50+ years old with a current diagnosis of anxiety and or depression, which has been coded in the last year. So the form is given to the patient to complete prior to their appointment, and then during their appointment, the clinicians can discuss with the patient and decide together which symptoms they have identified on the form that are of main concern for them or the clinician, which should take priority, and then take appropriate clinical action. So that could be a referral, a follow-up appointment, an investigation of some type, or no further action. And then if nurses are involved in the study, nurses seeing patients with undifferentiated diagnosis may seek advice from a supervising GP. So if we look at each part in turn, the first section, which is here, that question asks what the patient would like to talk about with the GP or the clinician, with the second section being a list of red flag symptoms that the patient can check through and tick any symptoms that they're worried about. This third section asks if there's anything else of concern, and then the final section inquires about which is the most important problem to discuss. So if you have any questions about the tool at any time, please do come back to us and ask us about those. So we have tested the SPOCC form with around 180 GPs and nurses and a similar number of patients in a study using vignettes, or a series of descriptive scenarios. And our key findings were that overall the feedback was very positive on this form. Well over 95% believed it would be useful when preparing for an appointment. Nearly 90% believed it would help them address patient concerns. 95% said they'd be happy to receive a completed form before each appointment, and 90% or over said that they would recommend its use. There were some clinicians who had concern over the possibility of the form adding extra time to appointments, but then there were others who thought it could actually save time by reducing the need for repetitive questioning. In terms of patients, over 95% agreed that the symptom list was clear, over 85% said they'd likely to complete this form, and nearly 70% felt the form would help communicate their symptoms more effectively. There were 10% who noted it could increase worry, but of course these are not insignificant symptoms, and often these would be discussed and investigated, and that would naturally cause some worry for patients. We also involved other clinicians and patient participants, as well as our patient and public involvement group, who all provided further feedback which helped us refine the form and the process. So in terms of practice involvement, as you know, some of you viewing this may have already attended our site initiation visit, but all members of the staff either participating as a clinician or as a key administrative member need to have attended the training, either in person, online, or via this recording of it. The period to be involved for the practice should be fairly brief, and we are aiming for practice to run a patient record search once per week for 4 to 6 weeks to identify eligible patients with appointments within the next 4 weeks. And that would be an appointment with a participating senior nurse or GP. So we envisage it to be approximately 3 months involvement, including patient invites to an interview, which comes a little bit later, and also completion of clinician interviews. So once each search has been run, there will need to be a manual check, and this would be preferably by administrative staff, because it needs to be fairly speedily after doing the search, i.e. on the day, to ensure that the patient is suitable. So to identify potentially vulnerable patients who should not get the form. So it's worth noting that this intervention is of low risk, and the manual check should be a light touch process, as the form itself is unlikely to cause harm, but the person checking the list will also need to look for any reason given for the appointment, so that we can exclude those coming back for chronic review appointments or annual review appointments. So we're looking more for those patients with undifferentiated diagnoses. And unless there's a very good reason to exclude that patient, or it's obvious that they're attending for an ongoing issue or a review appointment, then they should be included. There will be an Excel spreadsheet provided, which will need to be completed at the stage of each search and invite, and also every 1 to 2 weeks to invite those who completed a form to an interview, and we can support that process as much as we can. Patients are sent the tool by text, so that's SMS or email batch message, and invited to complete it prior to their appointment. So patients who are not online and who have indicated that they prefer not to be contacted by email or text will be given a paper copy of the form in reception just prior to their appointment and asked to complete it. So each patient would only be invited once to complete the form, even if they don't respond. So any forms returned would need to be handled as per your practice clinical document workflow procedure and shared with the relevant clinician prior to their appointment. And it's worth noting that some of these may come back only half an hour before the appointment, so there needs to be appropriate, safe and timely review by a participating clinician at the patient's appointment. And for anyone who returned the form after their appointment or at a time when their GP is on leave, the practice should handle the completed tool as a clinical document, regardless of whether it's completed before or after the appointment. Ensure the form is dealt with by a clinician participating in the study. The completed form is reviewed with them at their appointment, and the appropriate clinical actions taken, and paper copies would need to be scanned into their records and noted. Every 1 to 2 weeks, the administrator checks the records of patients who returned a tool and have had an appointment. These patients are sent a follow-up text or email using Accurix or the communication annex from the practice, containing a link to a web page operated by the research team, and so it's an invite to take part in an interview or share the contents of their form in an anonymous fashion. The patients who use the paper form will have already been given these materials, including a return envelope, by reception staff when they were given the communication tool. So patients who express interest in an interview would be contacted by the research team to provide more details, and if willing, to arrange an interview with a member of the research team. Participating clinicians will also be invited to an interview with researchers, so that would be 40 to 60 minutes in length. It's really important we get your feedback on the experiences of using this form, because it is a feasibility study and we need to know the positives as well as the pitfalls in how this works for you as a practice. So in terms of involvement for patients, patients with a scheduled appointment in the next 4 weeks are invited by the practice via a text or email to complete the SPOCC form electronically, or if they have no mobile or email address, they'll be given a paper copy to complete in reception when they come in for their appointment. The completed form is reviewed with them at their appointment and appropriate clinical actions taken. So patients returning the tool would be sent a follow-up text or email from the practice, which will include a brief study summary and link to a contact form if they are interested in taking part, either in an interview or allow the study team to access their completed anonymised SPOCC form. Those patients who express interest in an interview would be contacted by the research team to provide more details, and if willing, to arrange an interview with a member of the research team. Practices will receive a pack of materials to support the intervention delivery. This will include a System 1 or EMIS bespoke search, instructions to import and instructions to run a weekly search, also to export the patient lists, to manage the patient lists in an Excel file, and instructions to check patients who have completed the tool. They'd need to liaise with clinicians or appropriate members of the staff to ensure a system is in place for timely communication with participating clinicians regarding patients who have completed the tool. This is important that patients with a completed tool and possibly with serious symptoms are not overlooked. They would need to liaise with reception staff to hand out paper copies to patients not online and ensure the patient gives the completed form to the clinician prior to their appointment. And those forms will need to be scanned into the patient record. Administrative staff would maintain the SPOCC Excel spreadsheet and record those who have completed the tool. So additionally, every 1 to 2 weeks, the admin staff would check on the Excel spreadsheet, and eligible patients who have completed the tool sent a second text with an invitation to share their completed anonymised tool with the research team and or their interest in an interview with the research team. Patients respond direct to the SPOCC research team, so there's no further input on that from the practice staff. So the staff would need to keep the Excel spreadsheet updated with relevant detail or about who has completed this tool and who has been sent the second text. The research team will liaise with practice research administrators to provide anonymised completed SPOCC forms to the study team where patients have given consent, together with the patient's age and gender. We will also liaise with the practice research administrator to provide anonymised statistics of SPOCC forms sent out and returned, including demographic data such as age, gender and diagnosis, and that will be near to the end of the study. So in terms of clinicians' tasks, that would include reviewing an incoming completed communication tool prior to consultation, managing anyone who brings in a paper copy and reviewing it in the same way. Have a patient and clinician discussion around the completed form, whether that's online or paper, and about any new symptoms of main concern and any actions required. So, of course, nurses may have slightly different actions from their GP fellows. And then update the records where necessary, ensure the paper tools are scanned into the records. A completed tool should be handled as if it's a clinical document, so as your normal practice processes occur. So if on leave from your practice, like with any clinical document or test result, any forms being returned by the patients would need to be checked and dealt with by one of the other participating clinicians. If clinicians can no longer take part in delivering the communication tool, there would be an obligation for another clinician to manage the patients who have completed the tool. So that would be for those who completed the tool in the prior 4 weeks. So because this is a feasibility study, it is vital we gain feedback about the SPOCC intervention. So once we're nearing or at the end of the intervention period, we'd like to approach those clinicians who have taken part to take part in an interview and hear their experiences using the SPOCC form with their patients and any feedback on the process. So we will be providing detailed instructions and where it's required support for the searches and mail outs. We'll keep in close contact with practices and are happy to liaise by phone, email, or where appropriate in person or online. We're really keen to make this work for practice, so please let us know if any help or support or reminders would be helpful. Just to say, there is the Agile Research Delivery team out there. It's probably best to discuss what options are available with them, and just to note that it would affect the costs received by the practice. So the next step, so we should have now received a completed and signed organisational information document and the MNCA documents from your practice. We will liaise with the admin team to check if any further training or setup is required, and we will provide an electronic site file for the practice to store any documentation you require. And we would ask you to keep this up to date with any new documents that we send out. We have asked all participating clinicians and research admin managers or others involved in the study to sign the delegation log, and we would like a copy of that document once it's completed. Similarly, for all participating staff, whether clinicians or research admin, whether they have received the training in person, online, or through this recording, and then to sign the training log and send a copy back to us. We do ask also for some basic demographic details of those participating clinicians, and we will be sending out an email about that. We will send you a file called the practice setup activities to add in names of those in the practice responsible for what, which you might find useful, and ensure you have the practice processes set up. Lastly, we'd like to book a date to start the searches and intervention delivery, and then we can give the practice the green light to start. And we're happy to put some time aside to support you with these things. Thank you.